people come along, I always do this anyway, because it's weird. I don't really put anything in the title. It's always just the same thing, Bronchiectasis must goes live. And then I get a few numbers, so whilst I'm waiting, I'm just going to have a drink of my water. And I'll update you a little bit what's been going on, or what's not been going on. Make sure you're staying hydrated, because if you're not, you're making the mucus thicker by drinking more. You're thinning the mucus, and then if you take your mucus thin as well, even better. But also do your nebulizers. Stupidity in the world exists, from my mother to another person I know who says they don't need a nebulizer. I'm going to turn this on Do Not Disturb, because I was going to leave it because I'm waiting for a phone call, but I don't think these people are going to ring me anytime soon. It is now 4:30 nearly on the 13th of August, so I can't see him ringing me today, but I'll talk about that briefly in a minute. We'll give it about 2 minutes. If anyone does leave comments yet, I might not see them. Let me have a look, because it's not popping up here, but let me have a look. No, it's not showing me the comments, so I'm not being ignorant. Yeah, look, what's these filters? Yes, I'm just messing about. Right, so whilst we wait, because we've only got one watcher, that's a bit more authentic, innit? I look like I'm in a movie scene. So, right, I'm a bit pissed off. I'll tell you the truth, I'm very pissed off with my treatment plan at the moment. Not from a specialist standpoint, from the people who actually administrate the antibiotics. I'm absolutely pissed off with them. Nothing but an headache. Since they've turned from the home IV team into Northern Care Alliance, they're taking too much jobs on. So that's from bandages, you know, what else they do, go around and see people with diabetes, check the blood things, blood pressure, whatever they do, alongside IVs. Now you can see this is a failing system, because when it was known as the home IV team that only just worked administrating meropenem IV, ran smoothly. Everything was to the T. When you was due on, your referral go in, within a week, you'd be on your medicines. You'd get a phone call from the actual chemist, and the chemist would say, we're going to drop your medications off, Angelo. And then the home IV team would ring just to make sure the medications are there. And then they would say, okay, we're going to start your meds tomorrow. When they come, they check the boxes, everything was there and more. You'd have more gloves, you'd have more flushes and everything. So they discontinued that company who you know, provided the medication for us, and they started ordering them themselves. So then they got dropped off. Now, they don't do stock checks. No one comes in on day one, completely empty the box and check what's in. As they go, they realise there's not enough medication in here. Oh, we need to order this, or we need to get a flush, or this sits up. Now, a lot of staff have left. They probably couldn't deal with this amount of pressure on the system that the NHS is doing. Instead of keeping them as the home IV team, the Northern Care Alliance were thrown into one. And a lot of people were leaving, and I was scratching my head, and I was speaking to someone saying, something's not right here. All these people can't want to leave. Surely there's something going on. And I think it was just, overcompensating for joint merging into one thing, which is the most silliest thing to do. So, going back to my treatment plan, you can see my port there. Yeah, this is a long life treatment plan, which is every 3 months I get my meropenem. What's been happening now? It's been rolling into the 4th month, and then I'm getting not even getting a phone call. They're coming to do a sputum sample, and then you don't hear out from them. I'm like, what the fuck's what's going on here? Why have I got to chase my medication up? So then I'd go to specialist. Specialist would expedite it and say, come on now, get Angelo's medication going. And then 2-3 days later, I've still not got a telephone call saying they started my medication. And I'm like, these are stressing me out now. Yeah. If a specialist puts you on lifelong treatment, it's because you're a poorly person with a progressive lung disease that isn't going to get better over time, and you're on this to keep the cycle going. Now, nurses, they're not specialists and they don't understand this. So if you try saying to them, look, even if I'm not showing a great sign of infection or something in the sputum sample that's been tested, it doesn't mean it's not living in my lungs. I know how I feel. I feel drained. And every time I'm due my medication, I have a dip in health where I know certain things like sweating, going pale. You can see dark circles around my eyes. Yeah, these are all signs of me not being very well. Um, but but now they try to trick the system into, if you don't culture nothing in that sample, it means you've not got an infection. But as we all know, it's not always easy to produce sputum, and even if you do so, it's not necessarily that the sputum is going to contain an infection, because it depends where it is, where you got it. You could have it in your lower back, lower lungs, which is, you're never going to get it up in a sample. So they're annoying me. So I've chased a few things up today because I'm the voice, the hearts, bronchiectasis. I ain't gonna stop. That's one thing I won't tolerate, nonsense, in any walks of life, but especially if they're doing it to my peoples. And that's why I always say I'm kicking, screaming, and banging bronchiectasis, because I'm not laying down. Yeah, it took a very long time to get me here and get me on the right medications, and so somewhat having not a normal life, because you will never have a normal life with bronchiectasis. There's no normal in it. But get me into a place where I start feeling like I'm on the right treatment plan, things are going a lot better than they were. So, run into this garbage, what's going on at the moment. And I believe it'd be widespread. This is Manchester. I don't know what it's like in your neck of the woods, if you're under the, not home IV team or whatever they call themselves these days. But it's an absolute piss take. I don't want to speak to the nurse. I've already asked to speak to management. I've already logged the complaint with PALS, and I'll just sit and wait. I've already sent the email to my specialist saying they are now stressing me out to a point that's making me more poorly. I won't mention the person's name, but this person who is also alongside a similar cycle to me, they took bloods and sputum, I think, and they left him, completely left him. So they say no news is good news. And then you sit and you wait and you wait and you realise you're not feeling too well. You chase it up and all of a sudden you're growing pseudomonas. This is neglect, man. And this can't continue. This kind of neglect can't continue. If they can't treat me at home, then treat me in the hospital. I'll spend 2 weeks in hospital. I don't give a shit. I'll get away from people stressing the shit out of my life, day-to-day life. I'll go to the hospital, I'll have my medication in the hospital. If you can't provide me what your service is about at home, then my specialist needs to get me in hospital every 3 months. I'll have it as like therapy, retail therapy. Anyone messages me nonsense, they're getting ignored. And I'll just eat me grapes, me strawberries, and who else brings me some food? But I'll eat good food, not hospital food. But yeah, I'm pissed off, guys. I'm absolutely pissed off. I feel like, it feels like you're begging for the medication. That's meant for you. It feels like I'm chasing everyone around, and I've noticed when I'm phoning him, it's going on to answer machine. It never it never used to go to answer machine. It was always someone to pick it up. So it can't just be my phone calls they're not answering. It could be a load of people now going absolute ape shit that they're not getting the medication. Now what they need to do is stop getting first time people, because this is exactly what's happening. Because I've been told this and I know it is anyway. Get rid of that crap. So I know it's going on because just with interactions we've had, let me see if I remember what I was going to talk about. So with the interactions we've had, we know they're taking first time patients on. So when you get admitted in an hospital these days for a chest condition, the whole purpose is to get, if that patient can be mobile at home or have support at home, then their main purpose is to get them home on home IVs. Now this messes the system up, because you've got people like me who's on long-term treatment all their life. Now this person might have only grown pseudomonas once, and they're getting them from the hospital bed and getting them on lifetime antibiotics without them having to follow a guide, a strict guide that I had to follow, which was rescue packs, which was nebulized, all the nebulized medication in the world until they stopped working, and then I finally got my IVs. So why is it that someone's going into hospital with a Pseudomonas bug, right? Having 3 days of meropenem or tazazine, and then the doctor says, you know what, we can free an hospital bed up here. So what we'll do, we'll ring the home IV team or the urgent response team, and we'll get them home. So what happens is now they're getting an overload of patients, right? And because they're getting overload of patients, yeah, people like me who depend on this medication and have all their life are now getting pushed aside. And it's not right. And just because someone looks physically well doesn't mean they're well. Yeah, there's some people with good genetics. I'm not being a big-headed. My mother's got great genetics and my father have. Yeah, they're nearly bloody, I think they're about 80, and you wouldn't give them 80. And unless a person in our family look like they're dying, you'll think they're well. So I'm sick of it. I've had this kind of stigma with me all my life, and I don't stand for it. Just because I look well, you don't look stupid, but you are. So don't assume because someone has got a nice haircut, because someone looks well, they're actually well. Yeah. Do you want me to get? I always say I'll get my lungs out and show you. I've had this battle all my life, man. Human rights, any other rights. You chose the wrong one. No surrender, no white flag, and no peace talks. If we depend on these antibiotics, and we've been told you've got a porta calf, you've gone through surgery. It's not just minor surgery. It's like a major surgery, but you're awake. To actually cut a hole in someone's chest, put a plastic porta calf in with a wire in the neck, yeah, and then say, oh, we don't think you need your medications, you look well. Get to fuck, because it ain't happening on my watch. I remember when the British Lung Foundation were messing people about a few years ago, and we got a campaign going, and it worked pretty well, didn't it? Now then they were running articles on bronchiectasis. They were running all sorts of campaigns. Oh, look at this person who's run a marathon who's got bronchiectasis. Yeah. Why not run a campaign on someone like me? I can't run a marathon anymore. I probably could when I was younger, I was fit and well. But they sort of run away with something and make it sound a lot less worse than it is. And is it because there's a massive increase in bronchiectasis diagnosis these days? Are they, fobbing it off to just be some restriction in your lungs? It's a bit of scar tissue. You'll get over it. End of the day, it's like having liver cirrhosis, but you've got lung cirrhosis. Your lungs are rotting away. They don't get better over time. They get worse and they're rotting away. So, I'm going to go because I feel a bit tired, guys. And if I've missed anyone's comments, I genuinely didn't mean to miss it. But yeah, I'll keep you informed. On that because I've chased up a lot of things today, guys. I've no stone unturned. We've been here before, and every time we get delivered nonsense, we're coming back, kicking, screaming, banging bronchiectasis. I come out the womb that way, and I'm going in the ground the same way. Listen, it's a fight. No white flag, no peace talks, and no nonsense. We'll get there.